Hi, my name is Michelle Brose. I'm in my fourth class, might be my third class at MNU. I'm enjoying it, very challenging. I am a clinical education specialist for the Surgical Services Department, which is OR and peri anesthesia. Very challenging, very exciting. I'm enjoying it very, very much. Anxious to learn a lot in these courses for my master's in education degree. This is my wonderful husband, Jason. We've had a rough year, have had a brain surgery and have barely made that through alive. Had some ventilator time but he is wonderful and him and my family make life worth living. I have four children. This is a very big inspirational thing to me. For those of you that are not religious, I hope I don't offend you, but it's my belief. And this picture with Jesus Christ and how he would wash his apostles' feet, and he was doing an example for all of us how important it is that we serve one another and that none of us are above the other, and that we have to be able to be this kind of a person. And so I had a patient that I was providing diabetic foot care for, and I remember kneeling down and doing that, and kneeling into some dog's urine. And the reason I share this for you is because I had to control my emotions and just kind of go on and do the care, and the tenderness and the sweetness that that lady had, and how her gratitude for what I was doing for her. And I realized how fragile she was, and how fragile people are, and how they need us to really care and to really be willing to be there for them and lift them and overlook things. And anyway, it was a real changing point for me, and I've always kept this picture with me to remind me how important the other person is and how important our patients are, as well as our coworkers and everyone involved in our lives. Have always loved this saying, talking about that find gratitude in everything, good in everything, and it really changes your life. It changes the way you look at everything. This patient, Ellen, had cancer on the right side of her face. It it was really, really horrible. The smell was really horrible, and she was a tender, wonderful woman. She was on hospice, so I provided care, provided oral care, and care for that wound. And I remember one day I was caring for her, and her teeth fell out when I was irrigating, and she didn't know. Fell out onto my shoe, and I worked really hard at just making sure that she just didn't know. So she didn't know. And just helping her feel cared about, and helping her feel like this is okay. I'm here for you. I'm your friend. And it's important, and it's vital that these patients need to be number one, and that we need to be able to focus on them. Um, I've seen a lot of changes in healthcare. Electronic medical records has been big in the hospital, scanning medicines. Um, Another thing that I've really seen changing is the autonomy with our physicians, with their PPOs and HMOs, and having to be accountable for every second. But one of the good things that I really have seen with that is that our doctors remember all the preventative things they need to be doing, because they are being watched on that. And that may not seem important, but I can remember the days when a lot of doctors would miss important things. They were really lazy with their care. So, on one aspect, it kind of prevents that. For the future of healthcare, I don't know. I don't know what's going to happen. I have many fears about that, but I know it's not sustainable. And so I think my gut tells me we're going to see more and more technology, but we've got to be able to pay for it. So I'm not quite sure how that's going to play out. When I listened to Dr. Berwick's speech, I loved it, absolutely loved it, and loved the story of Isaiah, and understanding how the patient has got to be first, and how we've got to be a voice, understanding the importance of eliminating waste. And I watched some of his other speeches as well, and eliminating the waste that's going on. Does it help the patient? Does this really help the patient? And that needs to be our focus, and to really realize that even the very marginalized, the people that the people that scare us, okay? And I hate to say it that way, but people that are involved in criminal activity, people that are addicts on the street, they need our compassion. They need us to be able to care for them and focus on that human being. And so I truly enjoyed that. When I took a look at my medical insurance and compared that, yes, I was completely shocked. $650 per month I'm paying on my part, and my job is paying $12.97. That is almost $2,000 a month for insurance. I had no idea. That's not my dental, that's not my vision. How is that sustainable? I mean, it's pre-tax for me. I didn't realize it was going on. And I think about the rest of the world, how the rest of the country, how are they supposed to be able to afford that? My 10, my top 10. Okay. Now, granted, I am like learning so much in this course already that I didn't understand, and I'm so grateful for that. So my list may seem naive, but I'm excited to share it. Um, so my top 10 is the Medicare crash of 2023. I'm scared of that. Pandemics and epidemics that are going to increase. I know they are. Our poor preparation in the healthcare field. I teach, so I know what's going on and how ill prepared we are. And when it's something that's going to be a real killer bug, we are not going to know how to take care of it. So I just have lots of concerns there. Moving to a single payer source program that caps what we can spend on healthcare in a year. And so I really am worried about that. And can we do that and make it where we can still get specialized care? I don't know. Tackling obesity crisis with its direct and indirect financial burdens. Wanted to mention just Japan. Japan has this amazing program where they have kids that it's part of the curriculum. They cook from scratch. They make nutritional meals for the entire school. They're graded on it, and it's just part of the learning. I thought, what an amazing, amazing um, approach to stopping and changing the way we eat and approaching that obesity epidemic and disease-ridden bodies that we have in the United States. Number 5, inability for the elderly, the marginalized populations, and well, other families to be able to get public funding to access meds that they need. To understand our whole process. It's so confusing. It confuses us that really understand things. Standardizing the process of healthcare costs and all that's costing so much money just to deal with insurance companies. Trying to get some kind of a standard there, so it's not. Oh, we missed this word. Oh, they won't pay if you do this or that. Just where there's some kind of a standard that's easy to understand. And then also our decreasing enrollment in nursing schools, primary physicians, those are big worries. Um, I want to just end. I wish you the very best balancing your work, family, church, or other priorities in this master's program. I hope you learn a lot. Remember, take care of yourself and be the positive light. Make a difference with your patients and your coworkers and everyone you're around. Thank you.